Okay, perfect. So, first and foremost, I apologize for the delay. And secondly, let's proceed with our textbook discussion on the topic mental nerve block. I'm telling this for sake of completion because if someone watches the video later on, if you watch the video after a couple of days, you should have clarity on what we're discussing. So, before we proceed, let me ask you a few questions, starting with the position of mental foramen. So, where do you think is mental foramen located? Is it between the roots of premolars, distal to second premolar, or in line with second premolar? And second question, why do we give mental nerve block? Is it really required? So, what are the indications or what's the purpose of mental nerve block? Third question, what's its success rate? This is something which is very interesting. What is the success rate of a mental nerve block? And which areas are anesthetized? For suppose you're given a right mental nerve block, so which areas are anesthetized? And what's the position of operator and patient? What's the depth of penetration of needle? And what's the rate of deposition of local anesthesia? And finally, what are the complications associated with mental nerve block? Yeah, it's really good that you guys are trying to answer. So let's go through some literature as well, and then we'll decide accordingly. And this entire process of textbook discussion, I'm sure we'll find answers to these particular questions, right? So I hope you guys all have this textbook Malamud. I'm following fifth edition, whichever latest edition you're following. If at all there is any discrepancy, you're more than welcome to share relevant modifications or updates in the comment section, or you can get back through mail. So in fifth edition of Malamed, page number 246, let's proceed with textbook discussion, mental nerve block. Regarding the position of mental foramen, in Malamud, it's given as between the apices of first and second premolars, whereas in Wheelers, right, in Wheelers, they have mentioned that in almost 33% of the cases, it's found between first and second premolars, and in 11% of the cases, in line with this root of second premolar, and in almost 55% of the cases, distal to second premolar location of mental foramen in relation to mandibular premolar roots, right? So we'll try to review that part of literature as well. So mental nerve block is a terminal. So mental nerve as such is a terminal branch of inferior alveolar nerve exiting the mental foramen at or near the apices of mandibular premolars. It provides sensory innervation to buccal soft tissues lying anterior to foramen and soft tissues of lower lip and chin on side of injection. So these are the areas which are being anesthetized or being provided sensory innervation by mental nerve. Do underline the same, right? And then for most dental procedures, there is very little indication for use of mental nerve block because we go with, in case of floats, we go with IA and B. Indeed, of the techniques described in this section, the mental nerve block is the least frequently employed. It is used primarily for buccal soft tissue procedures. Do underline this point as well, such as suturing of lacerations or biopsies. Its success rate approaches 100% because of ease of accessibility to the nerve, right? So consider this very, very important. So what's the success rate of mental nerve block? It is 100%. Very good. Now let's move on to other common names. None. Nerves anesthetized. So obviously, mental nerve block, we're trying to anesthetize mental nerve, which is the terminal branch of inferior alveolar nerve. So areas anesthetized. Buccal mucous membranes anterior to mental foramen, which is around second premolar to midline, and then the skin of lower lip as well as chin, right? So my chin is obviously covered with beard. So indications. So as we have seen previously, when buccal soft tissue anesthesia is necessary for procedures in the mandible anterior to mental foramen, such as biopsies, suturing of soft tissues, etc. Right? So we have very limited and specific indications. Contraindication, obviously, any LA in case of infection or inflammation in the area of injection, and the reasons we have discussed elaborately previously as well. And the advantages, 100% success rate. So that's one thing which is very much desirable for any operator. So high success rate, technically easy, usually entirely atraumatic. Disadvantage hematoma, which we'll deal with in complications. Positive aspirations are very little incidence, 5.7%. Alternatives, local infiltration. Local infiltration is an alternative for almost any nerve block, right? We at least try with local infiltration if the main block fails. In fact, in one of our discussions, Ankur mentioned that one of his seniors injected water and they were waiting for more than 1 hour for that area to be anesthetized, right? So, inferior nerve block, Gaugate's mandibular nerve block, Vajrani actinosine nerve block are can be considered as alternatives. So, technique we use 25 or 27 gauge short needle and area of insertion. So, mucobuccal fold at or just anterior to mental foramen. So, mucobuccal fold will be the important landmark because that's the area of insertion. And target area is mental nerve as it exits the mental foramen, usually located between the apices of first and second premolars, as mentioned in Malamed 5th edition. Please let me know what's given in the latest edition. And also, I'll review some literature in regard to this in Wheeler's 10th edition, where they have clearly mentioned that the position of mental foramen relative to mandibular premolars and first molar can be described as follows. The foramen is between the first and second premolars in 33% of the time, in line with second premolar in 11% of the time, distal to second premolar 56% of the time. In terms of vertical position, so this in terms of horizontal position. In terms of vertical position, the foramen can be found coronal to apices 22% of the time, at the apices 15% of the time, below the apices majority of the time, that is 63% of the time. So consider these stats very important. You need not remember these stats as such, but at least know the majority. Like where do you find this foramen in horizontal orientation mostly, or in vertical orientation mostly, right? That's the take home message, right? I hope it's clear. Sixth edition also the same. Thank you, Neha. So if in case the question comes, I would suggest you to follow the information given in Wheelers. Okay, right? Because obviously that would be your next question. Landmarks, mandibular premolars, and mucobuccal fold, as we have been seeing, and orientation of the bevel towards the bone during injection. So orientation of bevel is also very important for any technique. And assume the correct position. For right or left mental nerve block, a right-handed operator should sit comfortably in front of the patient so that the syringe may be placed into the mouth below the patient's line of sight, right? So you should sit in front of the patient. As you can see in the illustrations given here, the recommended position for this injection has been changed in this edition. So what's there in 6th edition? Neha, please let me know. Many comments were received from doctors using this injection, mentioning that the old position of choice, that is sitting behind the patient, was psychologically traumatic for the patient. Why? Because they can't see you, and the first thing they say is the syringe with a needle, right? Obviously, it will be a very frightening or terrifying experience. So the syringe is always in patient's line of sight in old technique. So in new technique, we should sit in front of the patient, right? So that's very, very important. Yeah. Fifth edition, it's page number 247. Sixth edition, one of you can just let Jasmine know the page number, okay? And position of the patient. Supine position is recommended, but semi-supine is also acceptable. Have the patient partially closed. This permits greater access to the injection site, right? And locate the mental foramen by placing your index finger in the mucobuccal fold and press against the body of the mandible in the first molar area, inside in the mucobuccal fold. Move your finger slowly anteriorly until the bone beneath your finger feels irregular and somewhat concave, right? And the bone posterior anterior to mental foramen is usually smooth. However, the bone immediately around the foramen is rougher to the touch. It's all about dexterity and one's perception. The mental foramen usually is found around the apex of second premolar. However, it may be found either anterior or posterior to this site. We've seen the statistics in Wheelers. The patient may comment that the finger pressure in this area produces soreness as the mental nerve is compressed against the bone. So, objective signs and also subjective symptoms can be taken into consideration. So I can just get closer to the camera and try showing you this particular image. So as you can see, with an index finger, we're trying to place the same in mucobuccal fold in molar area, and then we should slowly move the finger anteriorly till we perceive that concavity, right? So consider that very, very important. And from next time, in another discussion or so, we'll try to use PowerPoint presentation for convenience, right? Now, if radiographs are available, mental foramen may be located easily. But having said that, we should go with slop technique, right? And prepare tissues at a site of penetration, dry with sterile gauze, apply topical antiseptic, which is optional, apply topical anesthetic for minimum of 1 minute, which is very unfortunate because in most of the practices, I don't see operators applying this topical anesthetic, right? It would be more comfortable for the patient if we apply topical anesthetic for a minimum of 1 minute, right? And then with your left index finger, pull the lower lip if you are a right-handed operator, right? Pull the lower lip and buckles of tissues laterally. This enables greater visualization, and taut tissues permit atraumatic penetration, right? Taut by pulling the tissues. The left, orient the syringe with the bevel directed towards the bone so that you can direct the anesthetic solution towards the nerve and penetrate the mucous membrane at the injection site at the canine or first premolar, directing the syringe towards the mental foramen, right? Towards mental foramen, not away from it. Advance the needle slowly until the foramen is reached. The depth of penetration, the question which we posed initially at the beginning of this session, is 5 to 6 mm. For mental nerve block to be successful, there is no need to enter mental foramen, not necessary. Aspirate, if negative, slowly deposit. So what's the rate of deposition of LA in mental nerve block? 0.6 ml, approximately one third of cartridge of 1.8 ml, zero point 0.6, right? Over 20 seconds duration. If tissue at the injection site balloons, stop the deposition and remove the syringe. Withdraw the syringe and immediately make the needle safe. Scoop technique, which is very, very important, right? So, you know, scoop technique. So never use two hands and then try to close the needle. So always use the scoop technique, which is very, very important. Obviously, it's difficult if it's a marker, but if it's a syringe, it's comparatively easy. And signs and symptoms, subjective and objective, these are very, very important for us to, analyze the success of that nerve block, any nerve block. Subjective, tingling or numbness of lower limb. Chin, patient might not say, but at least lower limb on that side. And objective, no pain during treatment, isn't it? So safety feature, this region is anatomically safe, which means no significant structures, anatomical structures that can be damaged in the process of this nerve block. Precautions, striking the periosteum produces discomfort. To prevent this, avoid contact with periosteum or deposit small amount of solution before contacting the periosteum. And failure of anesthesia, in case of mental nerve block, it's very, very rare. Hi, Parichay. Good. It's good that you always use local anesthetic. Very good. And I'm glad you joined the session. Complications include a few, but they have mentioned about hematoma, which we have seen previously as well. So hematoma, bluish discoloration and tissue swelling at injection site. Blood may exit the needle puncture point into the buccal fold. To treat, apply pressure with gauze directly to the area of bleeding for at least 2 minutes, right? So this is in brief about mental nerve block. And also you can see various illustrations. Sitting position behind the patient usually is considered old technique because patient can't see you. The first thing in line of sight is the syringe. So sit in front of the patient, okay? And then proceed accordingly as per the technique. And the structures which are anesthetized include the soft tissues. It's just the soft tissues, right? Mental foramen area anterior to it till the midline, and also the skin of lower lip as well as chin. Also consider this very, very important, right? So these are some of the objectives and procedure of mental nerve block. So I'll get back to the questions once again and try answering the same. I'm sure you're going to rock this session with answers for these questions. I hope it's clear. So what is the position of mental foramen? So what do you think? So based on what we have reviewed, where do you think mental foramen mostly lies? And what are its possible positions in horizontal orientation as well as in vertical orientation. Exactly. Yes, Neha. Position, patient position, supine is recommended, but semi-supine is acceptable. That's true. Yeah. I'm sorry, Vaishnavi. I mentioned it as 55%, but it's mentioned as 56%. But the take-home message is mostly, right? Mostly, yeah, distal to second premolar. Very good. And also, we see it can be found in different locations. It depends. See, you might see variation in these values because depending upon the sample size, the race, the population, the location. So various factors contribute to the results. So based on the literature we have, we can follow the one which is given in Wheeler's, right? So majority distal to second premolar. Yeah, between two premolars, 33%, in line with second premolar, it is 11%, right? Very good. Now, what is the purpose or what is the indication of mental nerve block? So, why do you want to give? It's infrequently given, but if at all you're planning to give, why do you want to give? So as we discussed, yes, biopsies, right? When we're going for biopsies or when you're going for suturing of soft tissues in the area, we're trying to anesthetize mental nerve, which provides sensory supply to the skin and mucous membrane in this particular region, lower lip, chin, as well as anterior part of a mucosa, anterior to the mental foramen location. Yeah, soft tissue anesthesia mostly. And what's the success rate? So if at all it's given in your exam in the form of an MCQ, what's the success rate of mental nerve block? So obviously it is very high, and to be more precise, as mentioned in Malamud, it is 100%. Very good. And what are the areas anesthetized? You just mentioned the same. And what should be the position of the patient and operator, right? So position of the patient, as Neha already mentioned, exactly. Supine is recommended, semi-supine is acceptable. So anything is fine. So what should be the position of, yeah, operator in front of the patient for the obvious reasons which we discussed. I really wonder how fast you are typing these answers. It seems you're all experts in chatting, right? So we should definitely have a competition. Well, I'll give you a phrase and let's see who is going to type the entire phrase very fast. Shall we have that competition now? Maybe at the end of the session. So is it 2 mm, 5 mm, 6 mm, or till you contact the bone? So we have literature clearly mentioning some values. So what is the depth of penetration of needle in case of mental nerve block? As mentioned, we can use 25, 27 gauge needle. So what should be the depth of penetration? Oh, I'm really sorry. Ho gaya, aa gaya. So what happened to the audio? I'm really sorry. It's prime time, right? Yeah, now audio is fine. Okay, perfect. Prime time technicality issues. Anyways, we'll deal with them. So that's the reason why I wanted to have this session at 8:30 p.m. Indian Standard Time, so that we'll not have these issues. Yesterday it was fantastic, but now we are in prime time, where the entire world, including India, is especially in this region, we're streaming. Okay, depth of penetration 5 to 6 mm. Okay, perfect. And what's the rate of deposition of local anesthesia? On aspiration, it's negative. So what's the rate of deposition of local anesthesia? Uh, Abhijit, I'm sorry, I didn't get your question. It only helps us to anesthetize soft tissues in that particular area. We cannot go for tooth extraction with this nerve block. Yeah, 0.6 ml for a duration of 20 seconds or one third of cartridge, right? So which means cartridge has a volume of 1.8 ml, right? Or 1.8 cc. We even have these calculations. Please refer YouTube. Also, you can check out our e-classes, okay? And finally, what are the complications associated with mental nerve block? No complications, or there can be chances of, yes, good, hematoma. Very good. So before we conclude this session, uh, we will have a competition. But before that, uh, I'm really sorry for the delay initially, but I hope it's worth it. And also regarding the exam dates and all, the moment exam dates are released, the moment something new is about to happen, the human tendency is that we'll have some extent of panic and worry, but it's absolutely normal. That's how our evolution has tuned us. There is nothing wrong in it. That's the reason why we always resist change, right? That's okay. The thing here is, are you analyzing it properly or not? See, we have gone through the information given in AIMS website. So when something is being done for your benefit, right, you have nothing to worry about. In fact, when something good is happening, you should welcome it. So let's hope everything goes as per the given statements in the notification, and let's hope it does more good to you, right? Without you running here and there for various kinds of exams, waiting, checking for various websites, website related links for notifications. You know, I know what kind of pain you all have to endure in this process. But hopefully, these new changes, I institute of national importance. And I really hope that all the institutes in our country, medical, dental, will be on some good day brought under this particular level or standard, right? So let's have a competition. Who is going to type this first? So the first three will be declared as winners, and I'm going to give you a chocolate online. Okay, it's all online these days. So the first three participants, so the first three winners, will be given online chocolates. Okay, are you ready? Okay, thank you for saying that it's worth it, because whenever we do something, if we have that intention of giving our best, I believe universe will conspire in our favor, no matter what we are doing. So thank you all for your love and support. So are you ready for the competition? Okay, here goes the statement, or I'll give you a paragraph so that you can type it out. Okay, just give me a few more moments. If you were really this enthusiastic, I would have planned this competition way ahead. Okay, here you go. So I will be reading out. So it's a test for all your sense organs. So I'll be reading out a particular statement. So whoever types it first in the comment box will be declared the winner. Okay, right. So here it goes. Ready, one, two, three. Don't type this. Okay, don't type this. Ready, one, two, three. Okay, I'm starting this competition. On your mark, ready, set, go. In case of inferior alveolar nerve block, the nerves anesthetized include, in case of inferior alveolar nerve block, the nerves anesthetized include inferior alveolar nerve, incisive nerve, mental nerve, lingual nerve. That's it. Do you want me to repeat? In case of inferior alveolar nerve block, the nerves anesthetized include inferior alveolar nerve, incisive nerve, mental nerve, lingual nerve. So, in a competition which is unique of this kind, I think this is the first ever competition, typing competition or chatting competition, which we had at PTPD Academy through YouTube Live. So, here are the winners. How can I decide? Almost every one of you typed the entire statement of phrase. How can I decide? So uh, it's like fraction of a second. You know, Usain Bolt's running competition. So it's difficult to decide. So every one of you is a winner. So let me read out winners' names. So the winners of this unique competition, chatting competition, are Sriparna Nath. However, Sriparna has used various shortcuts, just like how Usain Bolt tries to use a bike for 100-meter running. You tried using shortcuts, but that's okay. Appreciate your enthusiasm Redra Kaun, very good. So Srishti, winner. Urvi, Dhruvi, striker. What did you strike? Manav, Shreya, Pooja, Shivangi, Jakia. Very good. Sonali, Shivika, Arpana, Suchi, Rania, Sumita, Lakshmi, Parichai. The list goes on and on. Amy, Kavita, Vipul, Venusri, Sohini, Pooja, Pooja, Kirti. Yes, Jakia has given us additional statement. Madhusmita, Vaishnavi, Ankur, Parul, Jasmine. So it seems I have lost this competition, and every one of you is the winner. So I'm going to present you an online chocolate in our updates group. So, and you will be titled as the chatter, right? The chatter. Okay, guys. It was really fun interacting with each and every one of you. So, as I said, I'll update you if at all there is any live session, live discussion, YouTube live discussion. I'll update you at least 6 hours prior. No update, don't expect a session because, as I said yesterday, we are all facing several challenges and we need to take care of several things. I really hope you guys can understand. And if at all I'm planning a session, I'll let you know at least 6 hours prior, right? And also we'll come up with variety of topics in variety of formats, okay? So really appreciate all your active participation and enthusiasm. And for any further queries or assistance, you can always get back through mail at proudtobedentist@gmail.com. Well done, all chatters and batters. So I think this lockdown has enhanced your capacity at speed chatting or typing. I'm really awestruck. Believe me. Okay. Okay. Sure. Timings and all, we'll see. We'll definitely consider. Okay, guys. Take care. Love you all. Bye.